Hey, what's going on everyone? Dr. Beau here, and I want to answer one of your guys' questions today, and it's actually something that I have been seeing an increased frequency of in my practice, and I think actually timing is really appropriate. So what is that thing that I keep seeing? Well, it is springtime, so that means that a lot of you guys are out starting to work out more, go running, playing basketball, tennis, you name it. A lot of outdoor activities are starting to happen and kind of reawaken some of those winter bodies that you guys have developed. And the thing that I keep seeing over and over, matter of fact, about 3 times this week in my practice, is people are coming in and reporting pain on the front side of their knee. Matter of fact, just below the knee. And it's very typical that their history involves some sort of running, of jumping. A lot of my CrossFit athletes are doing an increased amount of box squats or box jumps these days. People playing basketball, and they're asking, number one, what is it? And number two, what can I do about it? Now, the most common diagnosis of this is what they call jumper's knee or patella tendinitis. And what that is over the front of the knee, over your kneecap, I'd bring my knee up here if I could, but you'll notice that there's an irritation, a tenderness, so to speak. We see this a lot in younger children, and there's actually a name for that called Osgood-Schlatters disease, but don't matter, it's a big name, right? But basically it's just the doctor that developed it. But the treatment is very similar for adults. And what patellar tendinitis it has to do with is that there is an irritation to the patellar tendon. Now the question is how does it become irritated? And number two, what can we do about it? Now the patella tends to get irritated from overuse or use that involves a lot of starting and stopping motions, such as playing basketball or tennis or what have you. And really what happens is that there starts to become an imbalance in the quadriceps. Remember, your quadriceps are your muscles on the front of your leg, and there are 4 different muscles. And what we usually see is if I put my hands down like this, the muscle that's on the inside portion of the leg. So if I'm thinking of my right leg, on the inside portion of that leg, it's called your vastus medialis oblique. And what that is responsible for is the last probably 10 to 20 degrees of knee extension. So if you think about like jumping up and down or doing knee extensions in the gym or quick motions back and forth while you're playing tennis or even explosive movements really quickly while we're doing CrossFit, that is the muscle that tends to be kind of overdeveloped. Now, if you've ever seen a bicyclist, it's kind of that big meaty muscle on the inside portion of their leg. It kind of almost looks like a teardrop, so to speak. And what ends up happening is that muscle becomes overdeveloped, overused, or really, really tight. Now, going way back to when you were just a little baby, if you remember this, is that babies do not have patellar tendons. Matter of fact, it takes about a year before the patellar tendon starts to develop. And the reason is that those 4 muscles, the 4 quadricep muscles, all combine into one and they wrap over the top of the knee. And matter of fact, the friction that we see having to do with the patella of these quadriceps over the knee creates the patella, and that's why you have the patella. It's considered actually a sesamoid bone, which means it's a bone that's not connected via bone on bone anywhere else in the body. We see those in the feet as well, by the way. Now, the question is what do I do about it? Well, I have a couple of tools back here. One of these guys is a foam roller. I love this company. It's called Trigger Point Therapy. I've worked with them in the past. The reason I like that is, as you can kind of see through this thing, this side is a solid piece of PVC, and then it has a, like they call it high density foam on the outside, which actually allows a lot of pressure down, and then it gives a little bit of stability as well. And what you can do is you can actually foam roll over the top of all of the quadriceps, including the inside portion of your vastus medialis. So you just need to put it at a 45-degree angle when you're working it versus a straight 90-degree on your quadricep. Or even better yet, they make a ball. They call this a trigger point ball. And the reason that I like the trigger point ball is, again, it's soft on the outside and hard on the inside. Sometimes when people are using like these massage balls, I sometimes kind of cringe a little bit when they say, yeah, I'm using a lacrosse ball. Now, lacrosse balls are great to get in there, but they're also very, very hard, which can sometimes damage the muscles a little bit. So I always tell people, start with a tennis ball, move up to a trigger point ball, or a ball with a little bit of cushion in it, and then if you need to, move up to the lacrosse ball. And basically what you're doing is taking the ball and just working over the tops of those muscles. Now, here's the thing. those muscles will tend to be tight on one side and weak on the other side. So what we typically see is like a vastus medialis oblique, which is very, very tight on the inside, and then a taut iliotibial band, which runs on the outside portion of the leg. So if this is my leg, just here on my right leg, this would be the inside portion here, which would be the vastus medialis oblique, and then this would be the iliotibial band on the outside. So make sure that you're rolling both the inside and the outside portion of the leg. And then the last thing I would also recommend that you do is spend a few minutes using your foam roller over the backs of your calves as well. That'll help loosen it up. Now, one more thing here is that when we have tendinitis like this, normally with any sort of tendinitis, we would tell you to use heat, but for this one, we actually want you to use ice. So make sure you're putting some ice over the top of the knee. Now, ice cup massage is the best. So what is an ice cup? If you guys remember those little Dixie cups they probably served you guys back in, preschool, the real little ones, go buy a bunch of those, fill them with water. Matter of fact, freeze them, then take them out and tear the top portion off and then flip it upside down and just kind of ice massage over the top of the patellar tendon in the front portion of the knee for about 5 minutes. Matter of fact, that's probably the deepest type of cooling that you can get other than like a full lower leg submersion in an ice bath. And the water will go everywhere, so make sure you have a towel underneath it. But yeah, that really helps to drive it down. Matter of fact, when I'm dealing with a lot of athletes that are suffering with this, what I'll have them do is do ice cup for 5 minutes before, then I'll have them use a foam roller for about 5 or 8 minutes, then stretch, then go out and compete, and then come back and ice cup it one more time. A common question I get, a lot of people ask me is, Beau, do you like those straps that go around, they're called a chopat brace, that go around the lower portion of the patella? And for this condition, I actually would say yes, only during competition. And what that thing actually does is it just changes the fulcrum, meaning if your patella comes down and you put the thing over the top of it, the chopat brace, what that does then is it makes this portion, wherever the brace thing is, actually the lever point instead of being over the patella. So that can help kind of alleviate some of the pain as well. So for all of you weekend warriors that are gearing up for this summer, make sure you're please foam roll before you start exercising. So foam roll first, then a light warm-up jog just to start to break a sweat, then do some light, stretching for 2 to 4 minutes, the entire body. Have a great exercise, and then make sure you do some static stretching afterwards. Eat a lot of good nutrition, drink a lot of water, and most importantly, have a lot of fun. Hope you guys are having a great day. I will look forward to talking to you tomorrow. Bye now.